G'day everyone, this is Health Highlights. Health Highlights is a show about health professionals and the people and the stories behind the names we hear about, we seldom get to meet. Now today, we're here at the new Attune Centre, super excited about our new building, and we have one of our new therapists with us. Jasmin, how are you, Jasmin?
Good, thanks, Simon. Thanks.
Jasmin is a functional medical practitioner, and I really wanted you today just to share a little bit about what functional medicine is and how you came to be Attune. So firstly, what is functional medicine?
Yeah, well, I guess functional medicine is a way of looking at the dynamic interplay that's happening within an individual. So it's looking at not only what's going on for them at the moment, but it's looking at their genetics, it's looking at their lifestyle and nutrition, which is their biochemistry. It's looking at the interplay between their different systems. And then, I guess, coming up with a treatment plan that's addressing those areas so that they can really heal from a deep level.
And I'm sure a lot of people out there are interested in knowing what's the difference between, say, a functional medical practitioner, a naturopath, and let's say a GP.
Yeah, well, I guess there's definitely overlap there. So with functional medicine, I started out as a naturopath myself. So, functional medicine, I guess, was just a way of becoming a little bit more, I guess, mainstream with my approach, as well as really increasing my knowledge of the evidence-based therapies out there. And it gave me a really good structure of how to assess people. So the difference between conventional medicine and functional medicine is, I guess, conventional medicine is focused a little bit more about the actual symptom that somebody's coming in or the disease, whereas functional medicine doesn't actually recognise that it's a disease. It's just a collection of dysfunctions within that individual. And if we can understand what's causing the dysfunctions and address those, then the person can heal from a deep level. And
you've sort of touched on it a little bit, but why shift from, say, naturopathy into this whole field? Is it generally because of the more mainstream, or?
Well, I actually considered going on and doing medicine myself, but I guess I really have a respect for herbal medicine and a great respect for nutrition, and I wanted to bring more of that into how I practiced. I liked the functional medicine movement because I think it speaks more to the medical community, which is who I'm wanting to work a lot more with as well, because I think that they need a conventional medicine practitioner, and they need somebody that's looking at their totality of their health and trying to pull all the pieces together, and is helping with the other modalities that are needed as well.
Absolutely, and I see that's why being at Attune is an amazing fit for you, because you've got the GPs and the mainstream, and then everybody all intermingled. And is that the reason that you joined us?
Yeah, I'm so excited. I've been waiting for this for a long time. So it's just, I think that Attune has really got the vision, and I can see that speaking to you, Simon, that that you're attracting the right people, the people that can see where health needs to move, and that it takes a community to really heal somebody.
Agreed, totally. And that community is so powerful, isn't it?
Yeah, absolutely.
So if someone was coming to see a functional medical practitioner, who is it that you want to be seeing, and what actually would you do with them?
Yeah, well, I see anybody really, but I guess I see either people who are really interested in looking at where their areas, I call it their Achilles heel, and everybody's got different Achilles heels, which might be their areas where dysfunction might occur first off. So, and they're being really proactive about their health. And then I get a lot of people that are, not getting anywhere with, I guess, conventional therapies, and are looking for a different a different approach. Maybe they're on quite a few medications. Maybe they've got a lot of dysfunctions that conventional medicine doesn't deal well with, and in my opinion that's like gut issues, a lot of the case, hormonal dysfunctions, and energy disorders, so like fatigue. So I tend to get a lot of people with those kind of conditions.
And so if someone was to come in, how long is a consult, and what sort of things are you going to be examining them with and using to actually help their condition?
Yeah, so initially I actually do quite a long consult initially, so it's 90 minutes for my initial consult, and before you can do that you do need to complete quite an in-depth questionnaire. So that first consultation, we're really trying to get a picture of who you are, where your dysfunctions are at, and what's led to create those dysfunctions. So we go right back in the timeline. We also look at if they've had any recent testing that have been done that through their GP perhaps, what their what diet they are currently on, what's their movement, so we're looking at that whole sort of health picture, starting with some real basic steps initially, because I sort of feel that you can't get too tricky straight off.
Right.
You've got to really start with the basics and get that stuff right first, and then we can build from there. So I
Awesome.
think it's a
And
second
yes,
part
and
of
so
that.
what sort of things, what sort of examinations are you doing, and other things do you use to really help the whole therapy?
Yeah. So I do a lot with nutrition because I think that that's really core. We need to be able to get the nutrients in. They need to be high quality foods that we're consuming, and we need to be making sure that we're giving the body everything it needs to heal. So I see that that's a really good core point of view. Also looking at with the testing, I start with what their basic testing that they have and doing some of the tests that I can do in the clinic, and then we can get more tricky if needed. So there's thousands of different tests, and I use a lot through the US and that if needed. So there's a lot of really cool tests, but it depends on a person's budget too. So I don't go straight to those. I sort of deal with what we can do initially and then work from there. And then when it comes to what else, treatments and things like that, I use a lot of, absolutely, like herbs are amazing for just trying to trigger somebody out of their current area of dysfunction and cause some change. So other things that I use, I've got live blood that I have a look at as well. I get some people to do some home testing. There's some really cool little things that they can do at home that's really no cost that can give me some really great information as well. So there's plenty of different things.
That's fantastic. And so when it comes to an implementation of their plan, what does that look like, and how onerous is it for people to actually follow the plans that you have?
Yeah, so I think you need to be, have some level of motivation, and that's another big part of wanting to come to Attune, to hopefully try to get that more support for the motivation for people to follow through, because you can know what's the right thing to do, but to keep, sort of trotting ahead and even if you fall off, your best intentions, and, to get back on and to, be doing the right thing most of the time is really important. We don't need to be perfect.
So what other things do they need to, follow through with in terms of treatment plan?
Yeah, so there's not really a set plan, because I try to treat to the individual. So some people are like they'll see me again in a week or two. Some people it might be a few months, to when they need to see me again, and it really depends on their level of support, their level of motivation, and how many different things that they need. Like initially we might need to get quite a bit more testing because we might not know where's the best direction. So I'll need to see them a little bit sooner.
And that's where healthcare needs to go, individualised to the person and to your needs, and to all those things are so important, because it really helps them navigate the journey they're on.
Yeah,
and that's what I love about what you guys do. So that is fantastic.
Yeah.
So look, one of the things that we always do is we always ask different practitioners their top tips on being healthy. So what would your top tips be to everyone out there about being healthy in 2020 and beyond?
Okay, so I would have to say it starts with the 5 pillars with functional medicine, which is getting good sleep. Nutrition, so movement, stress and relaxation, and with having a good community and support network relationships around you. So, and then I just wanted to add to that last thing is remain curious as well. So, like always thinking about why is this happening to me? Don't just, oh, my bad luck. Often there's a reason why you've got that particular symptom, and you need to look a bit deeper.
Absolutely, I love it. Jasmin, we love having you here, and you guys, you're going to love having someone like this around to be able to help. Functional medicine, you're the only one in the region, is that correct?
I think so. Yeah.
So to have someone like you in our region and the whole Hunter is really, really significant. And Jasmin is amazing at what she does. So if you're interested in finding out more about Jasmin and what she does, the information for what she does, and the website is on the screen for you right now, please give her a call. If you're just curious, I'm sure she'd be happy to answer some of your questions. And she would love to help you out in the future with some of your health needs. Thanks so much, Jasmin, for joining us.
Thanks, Simon, for having me.
And look, we thank you for joining us. We'll have another incredible interview next week. Remember, healing is a gift, health a responsibility. See you later.